Hi, everybody. Thank you for tuning into my presentation on vulnerable population health concerns. I'm going to be presenting on a cognitive and emotional impairment, post-traumatic stress disorder. First thing we want to look at with this, let's see. We're going to analyze our vulnerable population. And a couple ways we're going to do this is identify our population and give a brief profile on it. We're going to talk about some things that affect people who suffer with post-traumatic stress disorder and some health concerns that we're looking at with this population that kind of makes them more vulnerable than other populations. So, what is post-traumatic stress disorder? Post-traumatic stress disorder is an anxiety disorder, and it's associated with any trauma. It could be a car accident, it could be sexual assault, getting mugged. I looked at some statistics for Weber County. They were 4.8%. The state was 20%, national was 5%, and worldwide was about 7 to 8. I just plugged in 8 because you never know who is and is not participating in these studies. I did notice, however, that the state of Utah did have a larger percentage of people per capita than the national percentage. And this is mostly due to sexual trauma, is what I was reading a lot about. Now, some things that contribute to this disease and some things we can do to better serve this population. PTSD comes with a wide range of factors that affect you physically and socially. With PTSD, you have a lot of intrusive thoughts. You can be very mentally foggy. You're very fearful, heightened. I noticed in this picture, a lot of it says arousal, trigger, hypervigilance, and this is all very true, and it causes a great deal of anxiety. They're impaired economically because they might not have the energy to get to work, or they might not feel that they can work with the amount of disturbance going on. So that's definitely going to affect their income, and therefore it's going to affect their economic stability, where they live, how much food they can afford to buy in the week. It's going to affect their education if we're looking at a younger population, say like a high schooler. It's going to be really hard for them to focus in school if they have these intrusive thoughts, flashbacks, fears. A lot of the time these people feel that people can see their anxiety, and that's a negative belief, but it's very unfortunate. Impaired social and community context. A lot of people who suffer with PTSD tend to be reclusive. They tend to ignore social functions. They tend to ignore interactions because it can cause triggers for them. Some health concerns with them that I'll briefly touch on now, but I'll touch on more so later in this PowerPoint, is that when you are so heightened all the time and so stressed all the time, there's going to be that stress response. So an increased level of cortisol, it can lower your ability to fight off infection, and over time, with high levels of stress, it can cause cardiovascular disease, arthritis, chronic pain. And people with PTSD tend to fear getting care by healthcare professionals because it's something that we can't see. This is an illness that we can't assess by conventional means. So it's very unfortunate that they feel that they can't get the help they need. And there are specific things that help PTSD. EMDR therapy is great. That's eye movement, desensitization, reprocessing, and that seems to do very well amongst this population as compared to medication therapy. But those two combined do very well for this population. They can have an impaired environment. Again, it goes back to that social factor. They might not want to interact with neighbors. They might not be in the best economic place. So, moving on. Some specific concerns that we're looking at is they can neglect their physical needs often. Again, going back to that isolation and economic instability, those are some major concerns. The root cause is that impaired cognition. It makes them more vulnerable because, they really can't focus. They really can't feel that they're at their highest level of functioning. All of the levels of Maslow's hierarchy of needs are affected. So with this population, you'll anticipate more poor function, both physically and cognitively. That's not to be said for the entire population, but overall, it is very hard for them. Poor health outcomes, again, due to those long-term effects like chronic pain or, cardiovascular disease. Some concerns that we're looking at with PTSD is, again, I said earlier, we have an increase cortisol level due to that constant stress response. So again, they're at increased risk for infection. You'll see them getting colds more often, maybe the flu more often. And again, those sort of long-term chronic illnesses. They're at an increased risk also for substance abuse disorder. Oftentimes, this population can use substances to try to escape or not feel the feelings that they are. And this can also kind of have a domino effect into their economic status. If they're under the influence, they're going to have a harder time holding a job, and therefore they're not bringing in a paycheck. And this is very unfortunate. So PTSD, one of the main things is that they feel keyed up all the time, meaning that they're just functioning, or I guess their function is at a higher stress level. So they have an increased risk for unintentional harm. Oftentimes you'll hear people with PTSD might be in the middle of a flashback and somebody tries to intervene and the person intervening gets harmed because that person was unaware of what they were doing. PTSD makes those who suffer feel really depressed, a lot of hopelessness here. And this is really sad because a lot of the time they'll give up. Self-care is kind of put on the back burner. They have really poor energy level, and eventually it can lead into intentional self-harm and even suicide. So if you're interested more on this, here are some of my resources that I used. I did not include a resource for that EMDR therapy, but it definitely is something very interesting to look up if you're interested. Thank you again for tuning in.